Eczema is derived from a Greek word which means to boil out. Earlier, when in much olden days, when physician used to see skin problems which caused allergies, there used to be a lot of boils with oozing and all that. So that would be called as an eczema. Dermatitis is any reaction of the skin to anything external or internal. These are very general terms. So there are different types of dermatitis and eczemas, and these are huge topics. I'll try to condense them. Generally, in today's dermatology, eczema is a term used in British and Indian context, and dermatitis is used in American and other. It's like most English words. They are the same thing. Basically, eczema and dermatitis are the same. So generally, what I try to find out when a patient comes to me with eczema or dermatitis is whether it's due to external factors, which we call as exogenous eczemas. So many are there in that. Whether it's due to endogenous factors, that is internal eczema, or whether it is mixed. It's a combination of both external and internal. One of the most common causes of repeated eczemas is stress. So whenever a person is having lot of stress, that is in adults. And in children, one of the commonest causes of repeated eczema is called as atopic eczema. So in atopic eczema, the skin's barrier itself is defective, and they are very sensitive to a lot of external factors like dust. It could be synthetic clothing, it could be mites, it could be certain insects, and it could be so many other infections. Other causes for an eczema are how your body reacts to certain things. So when a person uses a heavy fragrance, he might start sneezing and develop a rash, perfume with a heavy fragrance. Whereas another person with the same fragrance may not develop any reaction. So that is called as internal or endogenous eczemas. In that, so many types are there. Lastly, eczema, just the term eczema doesn't mean anything. It's a diagnosis which is incomplete. You have to always supplement it with what is causing that eczema and try to remove the factor. So if you are trying to find out what is the cause of eczema in you, there are several tests like blood tests and patch testing and so many other tests which the doctor would suggest depending on the clinical picture of your eczema, which part of the body is involved and how it looks to the doctor.